In recent years, the issue of over-medicalization in mainland China's healthcare system has drawn increasing attention. One striking manifestation of this phenomenon is the excessive reliance on intravenous drips, a uniquely pervasive public health issue. Drawing from social media posts, news reports, and video content, we can see the deep-rooted complexity of this problem, tracing back through history, culture, and systemic factors. As described by ex-user Glazal Henmei, the infusion rooms in Chinese hospitals are crowded all year round, a situation dubbed a spectacle unseen anywhere else in the world. Statistics show that in 2015, China's annual IV infusion volume reached a staggering 12.7 billion bottles, an average of 9.2 per person, roughly 3 times the global average. National Development and Reform Commission 2015. For comparison, double average is around 2.5 to 3.3 bottles per person, 6-tone 2016. Even for common viral illnesses like the flu or a cold, patients insist on getting an IV drip, believing it's the only effective cure, sometimes even arguing with doctors to demand the treatment. This drip culture didn't emerge overnight. Its roots can be traced back to the mid to late 20th century, particularly the era of the barefoot doctors. As cited in the PMC article Antibiotic Culture, these grassroots medical providers, operating in rural areas with little formal training, heavily relied on antibiotics to bring quick symptom relief. This laid the foundation for a societal dependency on such medications. Antibiotics were regarded as miracle drugs, and IV infusions, due to their direct entry into the bloodstream and rapid efficacy, were embraced as a highly effective solution by both patients and doctors. In recent years, the Chinese government has attempted to curb this trend through policy interventions. In August 2012, it issued the administrative measures for the clinical use of antimicrobial agents, dubbed the strictest antibiotic control policy in history. The regulation explicitly stated that antibiotics should not be used for viral infections like the common cold and aimed to reduce unnecessary IV infusions. Yet, the results have been disappointing. As Lazo Hengmei noted, by 2015, infusion volumes had not declined. In fact, they increased, highlighting the difficulty of enforcing such policies. Behind this failure lies a web of contributing factors. First, there are structural issues within the healthcare system. User Kongwei Zhanghua commented that frontline doctors in China treat 2 to 3 times as many patients per unit of time compared to their counterparts in developed countries. The immense workload leaves doctors little time to explain diagnosis or treatment plans thoroughly. As a result, many resort to prescribing IV drips as a quick, seemingly effective solution to meet patients' expectations for immediate results. Second, the hospital revenue model also plays a role. While Kai Lazanmei argued that IV drips aren't that profitable, so hospitals aren't simply motivated by money, user 49MFR pointed out that IV treatments involve consumable materials, which can generate more income than simple oral medications. A 2024 Sohu article titled Drip Culture Becomes the Norm. Why are Chinese so dependent on IV therapy? Further explains that many hospitals, especially grassroots institutions, use drug-based services to generate income, a system known as supporting medicine through prescriptions. Beyond institutional factors, cultural perceptions also play a crucial role. Lai Hangmei shared his own hospitalization experience in Shanghai, Troy in 2018. He contracted acute hepatitis after eating contaminated oysters. The condition was severe enough that he had to be hospitalized. When the nurse came to insert the IV needle into his arm, he became visibly nervous. The nurse chuckled and said, "Why are you nervous about an IV drip?" Troy, his assistant, chimed in to explain. This is his first time getting an IV drip in his life. The nurse was visibly stunned, eyes widening like copper bells. Even though she knew he was a foreigner, she couldn't comprehend how someone nearly 40 years old had never received an IV drip before. When he shared this experience in a video, many overseas Chinese who had never lived in China found it unbelievable. Most of them had never had an IV in their entire lives. Others, who had emigrated from China, said it was only after moving abroad that they realized IV therapy was rarely necessary. One Malaysian doctor even commented that he had treated many new Chinese immigrants who insisted on getting IV drips. When he refused, they questioned his competence, thinking he was an unqualified practitioner. It wasn't until around 2012 that the Chinese Communist government began public health campaigns telling people that colds should not be treated with antibiotics and that IV drips were often unnecessary. Even if the drip contains no antibiotics, if a patient can eat and drink normally, there's really no reason to administer a saline IV. This cultural astonishment underscores how normalized IV drips have become in Chinese society. Many patients view them as a form of premium treatment, more effective and safer than oral medications. The Sohu article also points out that some patients even see IV drips as a form of psychological reassurance, believing that henging the bottle means the doctor is taking their illness seriously. This mindset contrasts sharply with international norms. In developed countries, IV therapy is considered an invasive procedure reserved for serious cases or emergencies. China Daily 26C. In the 2024 YouTube video, Why Are IV Drips So Common in China?, a Chinese doctor working in the US explained that many Chinese immigrants still request IV treatments, only to be advised to take oral meds or rest, prompting some to question the professionalism of Western doctors. The dangers of excessive IV use cannot be ignored. According to Sixth Tone, 80% of IV overuse cases involve antibiotics, contributing to 200,000 deaths annually from adverse reactions. Additionally, 300,000 children under the age of 7 suffer hearing loss due to antibiotic IVs, making up 40% of all childhood deafness cases. Meanwhile, antibiotic overuse exacerbates the global crisis of antimicrobial resistance (AMR). A study by the NHR found that China's antibiotic resistance rates are higher than in most Western countries, posing a growing public health threat. Over-medicalization also worsens the unequal distribution of healthcare resources. Local clinics are overcrowded, and patients often spend hours just to receive an IV for a common cold. Meanwhile, severely ill patients who genuinely require hospitalization face a shortage of hospital beds. This misallocation of resources further undermines the efficiency of the entire healthcare system. The system of supporting medicine through prescriptions should be dismantled. Doctors' pay structures must be reformed and their workloads eased to reduce the systemic incentives for unnecessary treatments.